I'm doing pretty good. How are you?
Oh, sounds. I'm also good, and thank you so much for asking.
Hold on just a minute. I
And
got.
I'm this call. Okay.
Hold on just a minute. My catheter slipped out.
Okay, okay, yeah,
Oh
sure.
God, it's bad. There's pee everywhere. Oh goodness. Oh goodness. Oh, okay. What was your question?
Yeah, so my question was like, have you ever been to a hip replacement surgery?
Yes. That's why I have this catheter in right now.
Okay, so like you had a hip replacement, right?
Yes.
Okay, so
And
may I
the
know what was
and
the
I
year
had
when you had that hip replacement surgery was done?
yes. Well, I had the hip replacement and the vag the mesh the vag mesh thing that you guys put in there, and it's oh goodness, it's affecting my sex life.
Okay, I'm sorry, ma'am. Ma'am, you had a vaginal mesh implant, right?
Yes, and a hip replacement, and I had some rectal tearing, but they for the most part, they fixed that.
Exactly, ma'am. So like you're okay. So ma'am, what was the year when you had that mesh implanted, ma'am?
Oh goodness, it was about 18 months ago.
Like in 2012, right?
Yes. And then, I
And
got to
ma'am,
be honest, but they didn't tell me that when I had, intercourse with my husband, that it was going to feel like I was, getting slung at by Spider Man.
got it, ma'am. I'm really sorry to hear that, ma'am.
Yes,
But
it's
now
horrible.
this is, the complications which a lot of ladies have been through after the mesh implant, okay?
Yes. Have you
And
seen the
don't worry about
report
it.
on the Have you seen the
Oh,
report on the Vadge bruising? There's about a 12-minute
uh-huh.
documentary. It's on YouTube. You know,
Yeah,
yes. Okay, what were you saying?
yeah, ma'am. Like, what was the reason you had that mesh implanted? Was it because of urinary incontinence or because of pelvic prolapse?
Oh goodness, it was because of incompetence.
Okay. And ma'am, like, after the mesh which was implanted is still there or it's been removed?
Say that again?
Yeah, the mesh which was implanted is still there or it's been removed, ma'am?
Yes. Are you going to be the one to come and remove that?
No, ma'am. I'm not going to come and remove that,
Okay.
but I will help you to get this financial compensation, ma'am.
Okay, do you have soft hands? Because the other doctors, uh, you know, I feel like it's just almost like being violated again.
Ma'am. I'm not going to come and take out the mesh, but I will help you to get this financial compensation, ma'am.
Sure.
Okay?
No, thank you.
Yeah.
Sometimes.
Hello?
Okay,
Hello?
maybe.
Ma'am, see, you will get this free legitimate financial compensation because you have suffered from complications because of the vaginal mesh that was implanted, okay? So you will be compensated with the amount of money for the
Yeah,
same, okay?
you know what they should
But I
call
will
it
see
is
what it
they should call it vaginal mess because this is
exactly,
horrible.
ma'am.
I mean, I no longer urinate. It's more like a urinine and a half. It's
Mm-hmm.
it's pretty bad. You should see this. You got email. I'll send you some pictures.
Oh, ma'am. All right, ma'am. All right. But, ma'am, like, do you have a problem after pelvic pain and vaginal pain?
Thank you.
Hello?
Yes, I support that.
Ma'am? Yeah, you have a pelvic pain and vaginal pain, right?
Oh, pelvic and yes, I have vag bruising.
Okay.
Very bad vaginal pain. I feel like every goodness, I can't even
Oh,
begin to explain some of the stuff that I've had going on.
I'm sorry, ma'am. I'm really sorry to hear that. But don't worry about anything, ma'am. And, ma'am, like, do you have a urinary infection?
Yes, but how do you not worry exactly? How do you not worry about cottage cheese and that kind of discharge that's coming out? I mean, when I pee, it's thick. It's like snot. Can you imagine blowing your nose every time you go to the bathroom?
Exactly, ma'am. Ma'am, because, a lot of ladies who have been through a vaginal mesh implant have suffered from exactly the same problem, which are, incontinence, problem during intercourse, pelvic pain, vaginal pain, and urinary infections, okay? Now, which you have suffered
Yes,
with.
and when you say
So you,
incontinence, you're talking about my squirting problem, right?
uh-huh.
The involuntary leakage of urine?
Yes, ma'am.
Okay.
Now, incontinence, right?
Yes, and have you ever tried to, with the catheters?
What's that, ma'am?
Yeah, with the catheters. Exactly.
All right. And ma'am, like, I believe that you might have visited any hospital doctor or clinic to diagnose your infection and pain, right?
Well, do you think that maybe I could get some of the tension-free, transvaginal tape?
Uh-huh.
Yeah, I'd like to, try to patch things up.
Ma'am, everything will be fine soon, ma'am. Don't worry about it. That's why, ma'am, I'm asking you. Like, where did you visit to diagnose your problems, ma'am? Like the name of the hospital, doctor, or the clinic? Do you remember anything?
Yes, it was, oh goodness, what was his name? It was Dr. Pepper.
Okay.
University of Louisville, Dr. Pepper.
Got it, ma'am. And did he prescribe any kind of medications to you, ma'am?
Oh, he gave me that good shit. He gave me the hydrocodones. Boy, they made me itch, and then I couldn't shit for a whole week.
Okay.
I mean, I took a shit, it was like a Coke can. I swear. I mean, talk about, Vadge bruising my anus. That's why I said I actually got a rip. I got ripped.
Oh. Okay.
Yes, it was horrible. I can send you pictures. That way you'll have them for the insurance.
Ma'am, no promise, ma'am, no promise. Ma'am, can you arrange the medical documents, medical records if needed in the future?
Arrange them. I have them right here in front of me. Look. I've got pictures of my badge and my torn rectum and pretty much everything. I even think there's a picture of the mesh. If you want to see that, but I want to talk to you about the tension-free transvaginal tape.
Okay, so ma'am, the mesh is coming out itself?
Oh, well, I hope so. Is that normal?
Like the mesh is...
Is it normal?
I mean, it's a complication.
It's
No, ma'am, it's a complication as well, ma'am.
It doesn't seem very complicated. They put it in there. It's going to come out at some point, right?
Exactly, ma'am. And ma'am, have you hired an attorney for this financial compensation?
Oh, goodness, no. I was just going to do it myself.
Oh, no problem, ma'am. And ma'am, please help me with your first name.
My name?
Uh-huh.
Pardon me?
Yeah,
You sound like you've got the phone in your mouth.
Ma'am, I want to have your first name, ma'am. I have your last name. It's Evans, right? What is your first name?
Sam. Mantha.
Uh-huh.
Yes.
What is Samantha?
Yes. You didn't even know my first name?
No, ma'am, I have your first name out here as Lori.
Yes. Samantha's well, I go by Lori, but it's Samantha Lori.
Okay.
Yes.
And ma'am, I have your, your address would be 3909 Cali Court, right?
Say it again?
Your address would be 3909 Cali Court, right?
You sound, like you're very far away.
Okay, ma'am, I said, I have your address as 3909 Cali Court, right?
I know who you remind me of now. It's Aziz Ansari. Have you ever seen that guy on the comedy thing? He's so funny. Yes, when he was talking about 50 cents and the grapefruit. That was one of the funniest things I think I've ever seen in my whole life. Were you privy to that?
Oh, yes, ma'am.
That's my address.
Sorry, ma'am.
Yes, okay, you've got my address. So you say you're going to be the one to come and help me take out the transvaginal mesh thing? What do you use, like forceps, or do you just go in there barehanded and do that, or how does this work?
No, see, as I told you before, I'm not going to come to pull out the mesh outside.
Okay.
Just telling you that I will help you to get this financial compensation, like a money compensation, okay?
Oh goodness, I'm so sorry. I apologize. So you're not going to be bringing any medication then either, right? Because I'm almost out.
No.
I mean, I'm scratching my ass off.
Yeah, you will receive a financial compensation from our side, so don't worry about anything.
Okay, so that's
I'm not going to come to, remove your mesh or anything like that. Okay?
I was just going to tell you that you're okay if you want to come by. I like you.
Oh, ma'am.
I was just giving you the invitation. I don't talk to very many sexy men on the phone, but you sound like a very nice gentleman, and you've got a good head on your shoulders, and probably some other things going on that I'd be interested in as well. So I just wanted to throw you the formal invite. That's why I've been offering you to send you these pictures and stuff. Now I thought we got a really good thing going, and we're getting there. Me and you are.
Oh, well, ma'am. Ma'am, I will definitely,
just say thank you.
I'll try to meet you someday, okay? Don't worry about it. But ma'am, is it okay if I arrange a call back from my verification officer in like 30 minutes, 30 to 40 minutes to discuss the case with you regarding the thing?
Oh yes, I can't wait. Now, is he gonna have the same, sexy accent that you have?
Okay. So,
Sure.
Like, ma'am, she will be a lady, ma'am, and that will be a lady. Right.
What?
Yeah, so like, yeah, she's a, yes, ma'am, the daddy will call you, ma'am. Okay, he's a lady, ma'am.
Yes, sure.
Okay?
What?
So let her know, ma'am, that you had a vaginal mesh implant and you suffered from a lot of complications because of it, okay?
Thanks.
Ma'am, she will let you know everything about the same and how much amount you receive and everything, alright,
Okay,
ma'am? So like,
this is-
30 to 40 minutes, important call for you, ma'am, please do receive that call, okay?
Yes. Okay. Is this good for you?
Well, it's good for me as well as for you, ma'am. Both.
Oh, good. I just want to make sure we both got off. Thank you.
Alright, thank you, ma'am.
Oh God, thank you. Oh, thanks.
Thank you, ma'am.
Oh God, thank you.
These motherfuckers.